Hello, I'm Henry Acosta, and you're listening to Health Professional Radio. On the show with us today is Associate Professor Anthony Lowe. Anthony is the Chief Executive Officer at the Prostate Cancer Foundation of Australia. The foundation is dedicated to reducing the impact of prostate cancer on Australian men, their partners, and families. Today, we're here to talk about prostate cancer in Australia and what we can do to support their foundation and what we need to know about the disease. Hi, Professor, and thanks for coming on the show today.
Thank you for inviting me.
And you're always welcome to come on the show. And can you tell us a little bit more about yourself?
Yes, well, we are the peak national body for prostate cancer in Australia, as you said, and we do three things. We have a research program looking for a cure for prostate cancer, looking to use the existing drugs and treatments that we've got better, and also doing research into helping men live better lives post-diagnosis and treatment. Second thing we do is raise awareness of prostate cancer. And the third thing we do is provide support to men and their families through 170 support groups all around Australia and shortly 43 prostate cancer specialist nurses.
And can you explain to us what prostate cancer is and what do we have to know about prostate cancer?
Yes, so let's start by just talking about what the prostate is, because not everybody knows that. So the prostate is part of the male reproductive system. Only men have a prostate, and it's a small organ that produces fluid that sits just below the bladder. And prostate cancer is when the cells in the prostate begin to multiply out of control, and eventually they may break out of the prostate and spread to distant parts of the body.
I see. And what are the ways that we can do to maybe prevent getting the prostate cancer?
Yes, well, that's a very good question. So one thing that's important to know is that we don't really know very much about what causes prostate cancer. We know the risk factors, but unfortunately you can't do much about that. So the risk factors are, first of all, being a man, obviously, and secondly, age. So it's really a disease that starts to affect men from their mid-40s onwards. So you can be diagnosed with prostate cancer earlier than that, but it's relatively uncommon. It's really a disease that affects men from their mid-40s onwards. The other risk factor that we know about is family history. So if you've got a father who was diagnosed particularly at a younger age, under age 60, or a brother or more than one of those, then you're much more at risk than the average man. So if your father was diagnosed, you're 2 to 3 times the risk, and if you had a father and 2 brothers who were diagnosed at a younger age, you're 9 to 10 times the risk of the average man. So those are the risk factors. Talk about the symptoms for a minute. It's important to know that often in the early stages of prostate cancer, when it can be cured, there are no symptoms. But if you have difficulty urinating, slow flow, needing to get up regularly in the middle of the night, or you see blood in urine or semen, or in some cases lower back pain, then they're all potential symptoms of prostate cancer and something you should talk to your doctor about. So what can you do? Really the thing that you can do is, if you're a man over age 50, talk to your doctor about being tested for prostate cancer as part of your regular health check.
I see. And for those who already have prostate cancer, how does it affect the man and his environment, maybe the family surrounding him?
Well, it can have, of course, like any cancer, a really devastating effect. For most men who've been diagnosed with prostate cancer describe the doctor giving the diagnosis as a period of complete shock. And then there are treatment options to consider: surgery, radiotherapy. For men with low-risk prostate cancer, they may be able to go on something called active surveillance, which is just monitoring the situation. So there are complicated choices to make. And that's obviously confusing and difficult for men. And that's where support groups and nurses can really help men think through those choices. If you do have surgery or radiotherapy, there are some important side effects that you can get. Urinary incontinence because the prostate is just below the bladder. Erectile dysfunction because the nerves that control erections are wrapped around the prostate. With radiotherapy, sometimes bowel problems. And with all of that goes relationship issues and potential for depression and things like that. So it can have a very, very significant effect on the man and his partner and immediate family.
I see. And how is the survival rate or the curing rate for prostate cancer nowadays?
It's improved out of all recognition over the last 20 years. So probably 20, 30 years ago, most men were diagnosed with advanced prostate cancer. There wasn't much that the doctors could do, and most men had very poor survival. That's changed. We've got the PSA test for early diagnosis, huge improvements in surgery and radiotherapy, to the point where the 5-year relative survival rate for a man diagnosed today is more than 97%, so very good indeed.
Wow.
And something like 3/4 of men diagnosed with prostate cancer will still be alive 15 years after their diagnosis. So we've really changed the situation from it being, if you like, an acute problem to being able to manage it like a chronic disease.
That's very good news to everyone, or to all men everywhere. And
yes.
For anyone interested in getting involved with prostate cancer or with the Foundation of Prostate Cancer of Australia, how can we get involved and how can we help or support people with prostate cancer?
Well, we have a range of ways in which people can support. Obviously, financial support is very important by donating to our programs. We have a range of volunteer opportunities as well, being part of that network of 170 support groups, getting involved. We have an ambassador speaking program of men and women who talk about the issue around the country. And of course, we've got fundraising events which you can participate in. For example, we've got the City to Surf in Sydney coming up, and we've got teams running in that and those sorts of things. So the best advice is to have a look at our website, pcfa.org.au, or to call us on our free call number, which is 1-800-220-099. And you'll see lots of different ways in which you can support us there.
Awesome. And what's the most common misconception that men usually have about prostate cancer?
Well, I think it's the old one, which is it's an old man's disease. And when people say that, I think what they think is, I don't need to worry about it. That's my grandfather in his 80s or something like that. I think men are shocked to discover, first of all, that more men actually die of prostate cancer than women die of breast cancer. So that's how significant it is as an issue in our community, and that it's not something that you have to think about when you're 75 or 80. You can be diagnosed with prostate cancer in your mid-40s. So although, of course, it's a disease of aging, men in their 40s and 50s don't regard themselves as old men.
And with everyone listening right now, what do you want them to take away from our interview?
The main takeaway message is that if you're a man over 50 or you're 40 and you have a family history of prostate cancer, then please talk to your doctor about being tested as part of your regular health check, along with all those other checks that you have as part of your regular health check.
Awesome. And well, that's all our questions for today. And thanks for coming on the show.
Oh, thank you very much for inviting me.
And that was Associate Professor Anthony Lowe, CEO of the Prostate Cancer Foundation of Australia. We just finished talking about prostate cancer and the PCFA. If you want to support and reach out to them, you can go on www.pcfa.org.au. And for more health-related interviews, you can go on www.hbr.fm. You can also find us on SoundCloud and iTunes. I'm Henry Acosta, helping promote health awareness, and you've been listening to Health Professional Radio.